One thing we try to emphasize is if when we see certain patients with cross bites or any situation that could cause injury or trauma to the front teeth, I always try to stress the importance of early orthodontic intervention, not just for cosmetics, but mainly to protect the permanent front teeth or a permanent back tooth from fracturing. A fractured permanent tooth is a lifetime of management. So, if we can help prevent those kind of issues, I try to always emphasize and show the parent the situation so they can make the proper decision for the child. So, when I do refer a child for early orthodontic treatment, it's usually because they have an issue that could become critical and change either the bony shape of their face, the facial symmetry, or again, any kind of injury can happen to a permanent front tooth. So, we usually will start the first phase of orthodontics to prevent those kinds of issues or to make space and prevent impacted tooth. Then, after the first phase of orthodontics is done, there's usually a break time where we wait for all the permanent teeth to drop in. Usually they drop in pretty nicely, but sometimes there can be a rotation or two. And that's when we do the second phase of orthodontics, where the last few teeth are rotated back into the correct orientation, and then the smile is done. So I always like to think of the original picture and what it could be if the child did not have orthodontic treatment. And when I see the final result, that's one of the things that gives me a lot of happiness and satisfaction. I always like to remind parents that the reason for expander is to shorten the overall time that you're in orthodontic treatment and to make as much space as possible so you don't have to remove any permanent teeth, which is the overall picture. The expander is great. It is uncomfortable the first day or two for children, but most kids adjust pretty easily to it. They're a lot slimmer and smaller than they used to be. I had an expander myself, so I remember what it felt like, but I would say the vast majority of our patients adjust after about a week or so after having the expander. So, my philosophy on early orthodontics has changed over my career. And one of the reasons that's happened is, again, I think orthodontic treatment it's important to look at the individual child. Some kids can really benefit from early orthodontic treatment. It shortens the overall time in braces, but we have other kids that are more sensitive than others, and some of them have more difficulty starting treatment at that young age. So again, I tailor everything that we plan for a child based off of their personality, their individual dental situation, and their dental health. So we look at all three factors and then make the best decision for each child. So again, when child starts orthodontic treatment, everything that we recommend is individual to the patient itself. So we have some kids that, are very timid and not, emotionally ready for braces. We have other kids that have a lot of cavities and we want them to be healthy before going into braces. And we have other children that have more urgent needs. For instance, if I see a tooth that is starting to become impacted, which that means a stuck in the bone, and we need to make the space, that's when I'll tell the parent, look, we need to initiate orthodontic treatment to save you oral surgery and thousands of dollars down the road. So, there are times where I'll say, yeah, orthodontic treatment is urgent and it's important. And I always inform and show the parents that situation.